Hello, I'm Celia Moss, consultant dermatologist at Birmingham Children's Hospital, and I'm going to tell you about a newly recognised condition of small children called Midface toddler excoriation syndrome, or MiTES. This is something that I first became aware of about 30 years ago when I saw a small child with nasty excoriations in the middle part of the face, which healed, leaving scarring. And over the years since then, I've seen a small number of cases, usually presented at meetings because they puzzle dermatologists who want to know what the cause is. And in most cases have been investigated for infective causes, inflammatory causes, neurological causes, without finding any cause whatsoever. Now, a clue came when an Irish family who had some other features, some suggestion of insensitivity to pain, was investigated as part of a big genetic study. And they were found to have mutations in a gene called PRDM12. And so that motivated us to look for mutations in the same gene in other families with MiTES syndrome. And by this time, I got to know of quite a few cases, and in particular colleagues in India had been recognising cases, and the fact that they always had exactly the same distribution with damage affecting the inner sides of the face, around the nose, onto the eyebrows. This reproducibility of this condition, such an unusual condition, made me feel that there really had to be a simple or single cause for it. So Professor Jeff Woods in Cambridge looked at the DNA from some patients sent by Dr. Sahana Srinivas in Bangalore and Dr. Fiona Brown in Dublin, and in 5 patients, he looked at 5 patients, and in 4 of them, from 3 families, because 2 of them were siblings, he indeed found mutations in the PRDM12 gene. The particular mutation is interesting because it's an extension of the gene caused by duplication, and in these patients there's a long extension. There are 17 or 18 repeats of a polyalanine within a polyalanine tract, whereas in other patients with congenital insensitivity to pain caused by mutations in that gene, there are fewer repeats. So it's good to have found the cause for this distressing condition. I hope this will go on to lead to a cure, and it seems to be that these children suffer 2 things. First of all, an irresistible urge to scratch the middle part of their face, and secondly, an insensitivity to pain limited to that area perhaps, which means that their behaviour is not modified by the sensation of pain.